Alright, so for column 2, we'll be doing the levator scapulae, pec minor and major for our muscle shortening areas. So for levator, we're going to stabilize the shoulder, side bend away, rotate away, and flex. Check for that muscle tension. Do it again on the other side. Pec minor, we can just spring posteriorly on the shoulders. Right side's pretty tight. And then for pec major, we take the shoulder into abduction and a little bit of extension, posterior springing, muscle tension. Alright, next we have the glenohumeral joint, which we'll check with aptly stretch tests. You just have your patient try and reach their hands behind their back, see if there's a difference in range of motion on either side, and lateralize to that side. Next we move on to the ulnohumeral joint, which will just be passive flexion, extension, range of motion at the elbow. For the radial ulnar joint, we will do passive range of motion again. Check for pronation, supination. And moving on down to the radiocarpal joint, we can do this two different ways. We can check this active or passive, but it will be range of motion both ways. So we can check extension, flexion, abduction, adduction, flexion, extension, abduction, adduction, or we can have Darby do it herself, an active method, flexion, extension, adduction, adduction. Check for difference in range of motion there. And that's column 2.